Welcome everyone to the Dr. Abs Healthcast. I'm your host, Dr. Brian Abasolo, aka Dr. Abs. And on today's show, we have Dr. Simon Maltais. He's an active cardiac surgeon and one of the world's largest providers of healthcare services. He's board certified from Canada, served as a previous vice chair of the Mayo Clinic, and he has a doctorate degree in biomedical engineering and heart regeneration. He is an internationally recognized leader in the field of heart transplantation, mechanical heart devices, and alternative cardiac interventions. Dr. Simon has worked in 2 different countries and health systems and provides a unique perspective on the delivery of care and its inherent challenges for healthcare workers, particularly in these difficult and tiring times. Knowing he had to make significant personal and professional changes, but unwilling to leave and relinquish years of clinical practice and training, Dr. Simon set out to find a comprehensive and organized way to regain control. Dr. Simon now leads a newly created physician-driven effort committed to recognizing, understanding, and mentoring all individuals functioning in high-intensity and high-demanding environments like healthcare, business, professional sports, and he wants them to perform at their best. I'm excited to speak to Dr. Simon, so let's bring him on. Welcome to the Healthcast, Dr. Simon. How are you doing today?
Good, thank you. And yourself?
Good. Happy to have you on. Very interesting topic that we're going to discuss today. You advocate for healthcare workers and their mental health in the workplace. And obviously, with everything going on with the pandemic, I'm sure they need your advocacy and services more than ever to help them with their mental health. But just for the audience, maybe give a little background on your career and everything that you're doing now.
Great. Thank you for the invite, first of all. And then I'm very thankful to have the chance to spread the word. I'm originally from Montreal and Canada, so I'm French Canadian. So that's the accent sometimes comes out that way. And then so trained in cardiac surgery there. Also have a PhD in biomedical engineering, and went on and practiced most of my career in the heart failure and less invasive heart procedures. Had the chance to work at great places, Vanderbilt, Mayo Clinic, over the last 12 to 15 years. And over the last 2 years it's sprung out of like personal challenges and professional obstacles, and then gradually just took interest into what everyone else was living as well, and decided to write about it. And so Healthcare Anonymous is a bit of a journey. It's been a 2-year project in the making, where we have gathered some opinions, some stories, and have tried to address some of those challenges that certainly COVID and the pandemic have put into light for us.
Yeah, absolutely. And you call it healthcare disease. Now, do you feel the system that's getting you well is actually creating sick workers?
Well, it's in some ways that's what I'm trying to advocate. But we talk about burnout a lot, depression, anxiety. I feel like it's oftentimes used a bit too easily in sort of categorizing things in some ways. To me, in the book, and that's what I'm trying to make in the book, is burnout and depression are the end result of a more chronic problem. And it's not necessarily the system itself. There's a big part of the culture, the perception, the demands, the changes over the last 10 to 15 years. The pandemic has been more of an acute moment, but some of these issues have been there for a while. And then there's, like any other disease, things that partake to the host, right? So things like the character traits, the behaviors, some of the interactions we have with the system, some things we learn in training. And so, as I described this in the book, the burnout is sort of the end result of 10 to 15 years of learning how to work into a system, trying to make your way into a system, oftentimes grow as an adult into a system, just like any other high intensity environments, whether it's being an athlete or being in military. There's a lot of sort of traits of characters and behaviors and systems that you have to adjust to. And so when it comes to burnout of anxiety, it's the sort of the misadaptation with it that sort of comes out. And so that's what we're trying to describe as healthcare disease, to say it's a chronic problem that people sort of start to develop way before the burnout or the anxiety kind of comes out.
Yeah, I mean, I totally can relate to what you're saying. I feel like a lot of times we forget about our own selves, right? We're so busy helping other people that we forget to show ourselves a little bit of self-love, and just to kind of disengage sometimes and just recoup yourself. But talking about those high intensity environments and the delivery and care and performance, I mean, usually you're dealing with people and trying to save their lives. It's like, how important is it for the medical minds and people that are taking care of these sick people? How important is it for them to be firing on all cylinders when they're treating, right? Because, as a patient, you don't want a doctor that's burnt out and, isn't focusing on what they're trying to accomplish. I mean, you want to get the best care possible.
Yeah, that's true. But the firing in all like 6 or 4 cylinders is sort of a figure of speech. But the way to do it is not necessarily the way that we're trained to do it. Meaning, 100 hours a week, saying yes to everything, not taking time for yourself, always seeing one more patient, accepting some of the interactions and some of the constraints that are put on us. And not being able to, in that way, put our limits. And so that's what we're trying to address in the book. And we do it a lot with education, more of a self-assessment and assessment of the environment that you're working in. And so it comes to really kind of firing those silent cylinders, but in a different way, So instead of driving the Porsche 100 miles an hour, then you may want to drive a different type truck and do it a bit differently within the limits,
Gotcha.
So I think we do. I mean, we don't just talk about negative stuff. We do also propose step recovery. That, I mean, through the testimonies I've gathered that people have gone through a certain process. I'm trying to distill some of that process. But yeah, it's. I mean, you want someone that is at the top of his game, but is at the top of his physical and mental strength for sure.
100%. So I want to definitely talk about that in-depth study that you just mentioned, but just for the audience, like, what are the symptoms of maladapted healthcare workers that you see in the field?
Yeah, and it's not what we think it is. I think there's the system's pretty obvious about identifying some of these really obvious things, right? Someone comes to work drunk, or is completely in a psychosis state, or has not attended to some of their responsibilities. I think that's usually pretty obvious, and the system's good at it. So these are the common ones. But I think what I've gathered over the last 2 years, talking to myself, but talking to other people, is that the symptoms of this maladaptive process is more subtle. And as the common theme is one of them is lack of empathy, is stopping to stop caring. You train in a certain way, and then all of a sudden having a complications or having a death even became like another day at work. And that's sometimes hard for a provider to realize, to say, well, I've been through all this, and this is not normal behavior. For others, and unfortunately it was for me as well, is to be angry. Being angry at work is not, or frustrated is not normal. Being angry is an expression of a deep emotion, in regards to a certain aspect of what you're doing. So people that are constantly in human resources, people that are angry or have difficulties, professional difficulties, is also a subtle sign of, say, depression, but for burnout for sure. And then there's the underlying word that is a big one, that's anxiety, right? So there's people not able to keep going and accomplishing the number of tasks, people even having being unable to go to work. I mean, I've had some people that have had chest pain, and every time they came in the hospital, and true heart attacks, So we describe these symptoms in four different categories. And sometimes it's as subtle as, personal failures, divorce, financial issues, loss, losing friends. Some of them it's a combination. So behavioral things like changing work. There could be physical manifestation, headaches, chest pain, shortness of breath, panic attacks. So, and even in the book, we have someone that unfortunately took his life. So there is a lot there's a wide spectrum of things. And as I say, the system is pretty good about dealing with acute stuff, but the subtleties of the identification of progressive issues is a bit more comprehensive and needs to be talked about for sure. Because to me, that's the real threat of the next 10 to 15 years in healthcare. It's not whether we can make surgery through an incision that much. It's not we can put a valve in through the groin. It's not whether we could transplant. I mean, it's cool that we can transplant a pig heart now, but it's really the how are we going to assess that deeper threat within.
Yeah, no, absolutely. And I mean, comparing and contrasting, I mean, I'm sure this burnout has always been an issue with healthcare workers, I'm sure, but how have you noticed it ramp up with the pandemic ever since 2020?
Yeah, I mean, it really has stressed the system, right? I mean, I'm sure you've experienced some of that stuff too. The anxiety for private practices or finances,
Oh,
the anxiety coming from administration. I mean, the last 15 to 20 years, we've seen a huge shift in hospital being managed by administration, right? So numbers, percentages, and then for right or wrong reasons. I mean, the hospitals are either better run or are better financially suited. And so, but entering into the pandemic, you've had a lot of hospitals that have called their employees heroes, but then and when it looks at the bottom line, there's only one letter difference between heroes and zeros, So
yeah.
in the end, we're starting to see United States, hospitals and private practices closing, people firing, thousands of people to recuperate from that bottom line. And so that has an impact for sure. And then all of the things that were sort of, it's like a rubber band, right? It was sort of stretched out already. And I think what the pandemic did is it just broke that rubber band where the patients had to be placed in a certain environment, the resources had to be put in, the money had to be put in to help people going through an acute moment, but the hospitals were already on the verge of breaking. So who in the end kind of got penalized with going to work every day and having to deal with that stuff? Oftentimes it's the nurses taking care of the patient, it's the patient himself at some point who's right next to another patient separated by a sort of a shower curtain.
Yeah.
COVID, non-COVID. So the system has just, I think, reached that point of break, that boy point, within the pandemic.
Yeah, no, it's been rough for everybody. Now, as far as the in-depth study that you mentioned earlier, what's the solution? I mean, you talk about simple steps to prevent and heal from this healthcare disease and just breaking through for a better life. Like, what can healthcare workers out there, because a lot of colleagues out there that are going through rough patches as well, and everybody goes through it, right? What can we do as healthcare workers to break through and prevent and stop and heal that healthcare disease that you speak of?
Yeah, I think what worked for me best was, I think it's the second step, but was to really take a pause, and that's easier said than done, because you're catched into like keeping up that we were already seeing hospitals ramping up again, patients coming back to our clinics, and so we just went through 2 years of hell, and then you're basically asking your employees and yourself to do more. So, but it's force yourself to take a pause, and that means cutting on things, and it needs sitting down and making. So there's two things that I've learned to differentiate. It's objectives and values. what are going to be your objectives? That's more of a company thing. That's more of a life goal, let's say, or short, medium term. But then what are the values that you want to put in, within your work and within yourself? And so that takes time, whether you want to be honest, when you want to be favoring some parts of your life that you've let go over the last 2 years. So that's really critical, but it takes time. And so you have to let things go. And for me, I was president of this, member board of that. I was doing 400 cases a year. I was publishing a paper every 2 weeks.
Busy.
I just needed to stop it. I mean, maybe temporarily, but then just break it all up, shuffle the cards up, and then just let them fall into different places. And that's what I think was, to me, the most important step. Taking a pause. It was 3 to 6 months for me. For others, it would be less. Because if you really want to get back into being in a flow state within that environment, you need to do that. Because if you don't, and you say, I'm good, I'm going to just continue and just put my head down and do it, you're going to hit a wall. So taking a pause and reassessing is critical. I think the one of the steps moving forward is to virus scan yourself. I use that term just medically, I think it made sense, but it's taking a time during the day to assess how you feel, whether you're stressed, whether you feel like you have too much on, whether you're going to finish again at 7 p.m., whether you have to get up at 5 or 4:30 to complete emails or projects you have to do. Whether you can't see your son, your family, whatever it is, then taking a time every day to assess that. And that's, also harder said than done. It's easier said than done. But once you do that, not have to be very long, you become more present, right? You sort of, you put yourself back in the moment and say, okay, today, what's going on with this day, and how do I feel about it? And where do I feel it? Is it up here? Is it up here? Is it in my back? Is it like in my neck? Where do I feel the day is felt? And that really has helped me oftentimes to reassess where I need to cut, what I need to do, what I need to readjust. And it's really becoming more sort of in sync with the day, right? Not because healthcare workers are pretty good about, and in general, about what we talked about in the book, we call it delayed gratification. We're trained that way, and sort of, and eventually translates in all aspects of our life. We're going to be happy when we're going to be done with a day and seeing all 20 patients. I'm going to be happy when I'm done with my residency and I graduate. Be happy when I get that Porsche, then I'll be happy when I get 3 kids. And so there's just this delayed, this becomes inner part of the profession, this delayed gratification. But learning how to assess the moment and see how you feel is critical. So if I have to choose two of the, and we go in details on how to do that, but I think if I have to choose the 2 most important ones, I think these would be the 2.
Nice. Yeah, no, I totally agree with you. And as far as you personally, obviously I think self-love is a big thing. You talked about checking in with yourself, but what are other things that you do and what you've noticed other healthcare workers do, to work on themselves, right? I mean, you can't pour out of an empty cup. Heard that saying a couple days ago, reminded me, and it's true, right? If we're wiped out and we're burned out, we really can't provide the best care for our patients. So what are things that you do in your personal life to, reconnect back with your profession, your family, and everything else?
Yeah, I'll give you the answer to this in a minute, but for me, but I through this journey, I found out, I sent out an emails to everybody that's been collaborating with me one day. And I said, give me a practical 3 things each one of you do, to answer that question. And you wouldn't believe the stuff that people have sent, the simple stuff, right? We talk about gratitude a lot, or, being thankful. Well, a person say, well, every morning when I brush my teeth, I sort of find 3 things which I'm happy for. Now we always have this notion that you have to sort of sit down and journal and sort of write it down. But the simple stuff, right? And then it says to him it was his salvation, and then playing games with his son, or the weirdest thing, doing push-ups every time they go to like a bathroom or some. So I mean, things that you wouldn't think about, but in the end, just it's all around the same theme, right? Doing something for you and not for others. So, and then doing it in a way that you'll remember it, throughout the day. For
Like
me,
different strokes for different folks, like different things work for different people, right?
right, exactly. And then a lot of I realized doing that I mean, people are doing a lot of things, to sort of do the thing, and we list all of them at the end of the book for each people, or summarize them. For me, I read this book recently that was enlightening to me. It's called Green Light, from Matthew McConaughey, and I thought the power of it's really about the power of journaling, and it started to me to be an important piece of my recovery 2 years ago. Started to be a way for me to identify what am I doing when things are going well. I mean, people have tendency to journal when things are going to shit, when things are not doing well. They start, in this, I wish I could do this better and things. But then what you can do is go back to this and say, okay, what am I doing when I'm hitting these green lights, when things are going well? What was I doing? And it's been very valuable for me. And it was the origin of the book. Now, the second thing for me, and I don't want to take too much time, was to really kind of reassess that pie. For me, work in medicine in general was a calling. It was a sprint. And I mean, by 40, I had built 2 programs. I was vice chair of Mayo Clinic. I had published 150 papers. I was on a plane every 2 weeks, internationally and nationally, to give talks. And I was just 95% of that pie was work. And then 5% was the gym. And then there was nothing else. Right. So, but first you have the really kind of weird physique when you do that, because you don't really take care of yourself, and you become big biceps, but not with 50 pounds overweight. But to me, it was like reassessing where's the family stand, who are the friends, and whether they bring me, how much place do I want to bring to my health. And so decreasing that percentage to something that was manageable, because guess what, when things are, there's always a place in your life when things are not going well. I mean, that's just the nature of life. Failures are there to grow. That's sort of a common theme. So there's a part of your life that will not go well. But if all the life goes around work, if that fails, then you're stuck into those situations when then you're burned out, you're depressed, you sort of start drinking. And so for me, it was to really rebalance things and journal.
Nice. What does the pie look like today for you?
Well, as a big part of family, my wife is pregnant. Gosh, we're above 40, and we're having another baby. So that's we also take a lot of time to dedicate to family and travel with family. Spending time with my son became a big part of it. I went on a mission to Thailand. I lost 40 pounds, and so being that's why I said the look is kind of weird before, but I think being more in sort of in balance with myself, just really being healthy, valuing friends, family, and then work is there, but work is different. Work is not a sprint, it's a marathon. I do a case a day. Sometimes 2 I have to, but a case a day. I have my day clinic, my protected time during the week. I control things a bit better. I have the chance to dictate a bit my schedule with my partners. We all have the same mantra, sort of valuing, balancing life. And so we do have a lot of time away from work every month. But when we're there, we're very effective. We're doing a lot of surgeries and things, but we then go and turn things off. And so I don't do the meetings anymore. Like I stay up to date, but I don't hang out in meetings anymore. I don't travel 3 days in San Diego to have fun. I I just do it differently. And when work finishes, I just go home. I don't go have a drink with my friends, or my partners have their life. I have my life, and we just value things differently. We don't hang out and value the dinner, with colleagues having drinks and things. So we just go home,
Yeah, no, I totally feel you. I love that, setting boundaries, you know what I mean? Not overworking yourself, having that healthy work-life balance, the journaling, that's something that I don't do, but that's something that, I think could definitely help a lot of people. And I think the book, not just for healthcare workers, but, there's a lot of people out there suffering from burnout that possibly the book can help. So go ahead and please share with us where people could find the book and just what they're going to get out of it.
Right. So healthcareanonymous.com, you get the book. You can pre-order the book. The book is going to be on all the major distributors. You can pre-order it on Amazon now. It comes with all the usual, the ebook, the audio book. We have special offerings on the book is a tool, but we're offering more in the book. The point is to really kind of leverage on a message. If you go to the website, I've created a workshop. We have 1-day workshop. We have a work assessment program that we can go and help your team function better. We've created a breakthroughpoints.com, which takes all the elements of what we talk in the book and expand it to other high intensity environments. So because the themes are all common, when we talk about perfectionism, we talk about ego, we talk about time management, we talk about competition, we talk about character traits acquisition. So I think a lot of the I've associated myself with other partners, and we're expanding that offering to any high intensity environments. So military, veterans, high intensity environments like athletes. We have athletes that have reached out to which I'm working with, and actually we've partnered with one recently retired athlete. So we're really trying to spread the message. So healthcareanonymous.com, and then Breakthrough Points is where you can find more information about it.
Amazing, guys. Thank you so much, Dr. Simon, for coming on and sharing, everything that you're doing. I think you're doing great things for the healthcare workers, not only of Canada, but around the world. And, better healthcare workers just going to mean happier patients all around. So I'm happy to see what you're doing. And I'm proud to call you a colleague in the healthcare field.
Well, thank you for the invite. This is always a tough topic, but I certainly appreciate the openness. And for a heart surgeon to talk about the burnout, it's not a very common theme, but I appreciate the venue.
No, it's real, and I appreciate your openness and the vulnerability. Thank you so much for coming on.
Sounds good. Appreciate it.
All right, Dr. Simon, take care. Have a good one.
Yep.